Hello again friends, I am Dr. Bhushan Sabnis. As you know, I am an orthopedic surgeon and a knee specialist, and thanks for watching my YouTube channel. We have been talking a lot about various knee problems. Now we are going to talk about a very common question that most patients ask me, which is the exercises that they can and cannot do while maintaining the knee function. So there are two things that we are going to talk about: general exercises which are very useful to preserve the knee function, and the exercises which are allowed to do when a person gets onset of arthritis in the knee joint. This is a very important subject. Now, what happens in arthritis is usually various deformities that make the knee load abnormally. The damage in the joint surface or articular cartilage leads to increased friction, swelling in the knee joint, and further worsening of the deformity. So this is what we call as a self-feeding beast or a vicious cycle. It needs to be broken somewhere. One of the important components of arthritis is the weakness in the muscles and swelling in the knee joint. Physiotherapy exercises work wonderfully in these patients in getting the strength back and getting the movements back to the knee joint. So let's talk a bit about that. I'm going to show you a few exercises on one of our patients who has kindly agreed to be a volunteer for this. So let's have a look. Hello. Hi. So now we are going to demonstrate a few of the core strengthening exercises which are very important to strengthen the lower back, the gluteal muscles, the hamstring muscles, and essentially very important in preserving the knee joint function without loading the knee joint significantly. So what we are seeing is the bridging exercise that is going to be demonstrated by my friend here. So essentially speaking, what he is doing is lifting his pelvis up while resting his legs up on the Swiss ball or the gym ball, and this in effect improves the tone of his lower back, his gluteal muscles and the hamstring muscles, and it's very essential to maintain the harmony of muscles in the knee joint. Thoda knee bend karke dakho na thoda sa. Same. Let's bend the knee and show the same thing. Same thing again. So to make it slightly more, ready? To make it slightly more difficult, you can do the same thing with the knees bent, and it becomes more difficult, and as you can see a lot of force is required, but this is very important to strengthen the hamstrings or the back of the knee muscles. Well done. A lot of the exercises that we normally do have their roots in yoga of our culture, and one of the important things that I recommend most of my patients is the core strengthening exercises such as this. This is known as plank. Let's do the plank, right? So simply speaking, all he's doing is squeezing his pelvic muscles tight, squeezing his lower back muscles tight, and maintaining an erect posture, just resting on his elbows and his toes. And if you can maintain this flat position for more than 30 seconds, it essentially indicates you got good core strength, and this is very essential in maintaining your normal posture, especially when you're walking. An important non-impact quad strengthening exercise that I usually recommend most of my patients, whether they have arthritis or they are non-arthritic, is cycling. Cycling against resistance is a very important and essential exercise to build up your quad muscles, your glute muscles and your calf muscles, which are the sort of the anti-gravity muscles in your body. These are the main groups of core muscles. The more you work on this, the more your knee strength is, and you're able to easily carry on with your normal day-to-day activities with good muscle strength. Yeah, okay, so through a very complex mechanism in our body, the strength of the hip abductors, the muscles which control the hip motion, are very important in maintaining the knee function. So what he's doing is known as abductor strengthening exercises. So he's working on the side of the hip muscles, which are very important in reducing the knee adduction moment, which is where the pain usually happens in most arthritic patients. So this is a very important exercise, very essential for most patients who are either having early arthritis or who want to prevent onset of arthritis or delay the onset of arthritis in their life. So one of the buzzwords in arthritis exercises is non-impact quad strengthening exercises. These are the exercises in which your body weight is not actually going through your knee joints, and one of the best exercises I ever recommend to most patients is the rowing exercise. A rowing machine works brilliantly in getting good amount of strength in the calves, in the legs, in the thighs and in your gluteal region as well. It also helps in maintaining a good posture. It also works on your shoulders and your lower back. So this is one exercise that I recommend to most patients, be it a lady of 80 or be it a man of 25. It works really well in most of the patients. And lastly, the most important, one of the most difficult exercises which works exactly where the problem is the leg press exercise, which essentially works on getting the quads strengthened straight away. It's a very good exercise, but it's slightly more painful for patients who have issues with the kneecap. So I usually recommend not to lock the knee in a straight position, but to stop at that level and then bend it to as much as you can. So that works brilliantly in getting the quad strength back in most arthritic or non-arthritic patients, and this is something which is recommended to most of my patients. So these are the exercises that I usually advise my patients who have either early or moderate arthritis, and even those who are post-operative and are recovering from various surgeries of the knee joint. This is the easiest way to get back into action, and you don't need any fancy equipment apart from what you have just seen. So it's said that the doctor's job is only 50%, but the patient's job is more important than that in exercising and getting the knee back to normal. So everybody should understand the importance of exercises. You need to understand and perform all the exercises diligently and thoroughly to get back into action. Hope this was fairly informative. We'll talk next week on management of meniscal pathology inside the knee. I'm going to talk about the meniscal tears and how they can affect the knee function. Thanks for viewing my channel. Thank you very much.